To the heartbeat. I'm your host JoJo Williams. Listen, I'm back down in Grove Town with my doc friend. What's up? How you doing today?
See you again. Absolutely.
Listen, today, man, I'm talking to all golfers. I mean, I went to Saluda. I mean, Augusta, and man, I'm talking to these guys. Some of them older, younger, but they still have them pains. What are we gonna talk to them today about?
Sure. I treat a lot of golfers. As you know, I have two offices in this area, in Grovetown Accident Rehab, and I have one in Aiken, South Carolina. It's just called Aiken Chiropractic. I'm actually working my Aiken shirt today. Of course, Aiken is a big golfing community as well, so I get a lot of golfers. They hurt themselves a lot with the swings, you know, so maybe it's not the way they're doing it, it's not maybe done properly, maybe they hit the ground or something, maybe just, I guess it might be a problem the way they're doing it. But even if you do it correctly, I think that kind of motion, probably if you keep doing it repetitively, can actually twist your back out. So I see a lot of that going on, and you know, we treat them. So they have a lot of, you know, lumbar or sacral injuries, which is, you know, the lower back injury. So, you know, they come in and we treat them with that. I treat all kinds of people. So, you know, believe it or not, I really don't play golf. I don't really have time.
Well, I do. And what you're saying right there is kind of true.
Yeah.
Because one thing, when I tweet my injury a lot of times is the lower back.
Yes.
I think I overswing. I'm swinging too hard, you know, or something like that. And you hit that on the head.
It is. And so maybe they need to look at the technique and maybe need to practice. But if it starts to hurt, if your back starts to hurt and there's kind of burning sensation in the lower part of the back or some kind of a achiness or maybe a sharp pain, I probably should take a look, or I mean call somebody like me, because they really need to be checked in. Most of the time, the vertebrae in the lower back ends up getting shifted like this, he gets locked up, and then it causes tension on the nerves that I can actually fix. So we take x-rays, you know, we do an exam on them. We take, for the lower back injury, you need two x-rays. You need one this way, one sideways to see everything. And, you know, you have to also have to rule out the disc problem. If it's a compressed disc, then if you end up having some kind of radiation of pain or numbness down the leg or legs, well, that could be another thing. So, you know, we need to look at that. So if it's a chiropractic type problem, then I can help. Even if it isn't, if I see certain things that are not what I do, if I take an exam and x-rays, I will refer them. I will refer them to orthopedic or neurologist or somebody else that, you know, is good in my area that maybe they need to see. I can also, as a chiropractor, order an MRI, and we order MRIs all the time, because in the MRI you can actually see the soft tissue, the nerves, and the discs. So when I send patient for that and the MRI report comes back, I can read it, I can see if, you know, they need to be referred out or this is something I can do. I also do something called spinal decompression. I do it in this office and in my Aiken office. You have to have a specific table for that equipment, and I do. So the patient will lay down on that, and the table can separate, and you can kind of move them up and down and side to side like that, and really feels like stretching to somebody's lower back. So it doesn't hurt or anything, it's gentle, but that can unlock the areas of the injury gently, so there's no pressure on the spinal nerves, and that stuff kind of heals a lot quicker. We also do ultrasound, therapeutic ultrasound, and electric muscle stimulation to decrease the muscle spasms and let the tissue heal itself a lot quicker. And of course, we do chiropractic. We also can give them rehab exercises that are appropriate for the injury to strengthen the area and give them more mobility as well. So yeah, that's kind of what we do. So we do a lot of golfers as well. In Aiken, I do a lot of horse people. I guess riding horses and dealing with them, it's kind of difficult. And of course, I do people in car accidents in both offices. That's why I call the Grovetown office Accident Rehab, and Aiken is called Aiken Chiropractic, where we see all of them as well.
Okay, I like it. Now listen, one question too, because I love this segment. I told you, this is one of my favorite segments of this show. When a lot of people think just because they ain't been in an accident or anything like that, that they don't need no chiropractor. But I know a lot of people just come regularly. I know you got a deal that you're doing.
Yes, we do actually. People, when they see that this helps them and they want to use it as a part of their wellness care to stay in a good shape, kind of like, you know, eating right or exercising daily or you know, things like that. It's part of their normal life. That's called wellness. We call it Power of Wellness. And Power of Wellness program is, it allows them for $59 a month, they can come up to 4 trials, 4 treatments a month. And each treatment includes chiropractic treatment and a therapy as well. So, and that's $15. It's like less than $15 a visit if they want to do it.
All right.
Absolutely.